Thomas, thank you so much for joining us. And joining us now is the Health Minister of Kerala, Shilaja. Thank you so much for your time here, ma'am. Give me a sense, how are the numbers today? And are you of the opinion that the worst is over and behind you?
Yes, we have today only 3 positive cases. Out of that, 2 are contact and one UAE returned man. And it's a positive sign that the number of positive cases are decreasing, and also the contact cases also decreasing. And we have only now 178 positive cases in the hospital. Today we have 19 negative cases also. Negative who were positive become negative. And Kasaragod district is the most affected district. And today from Kasaragod, 12 negative results were there. And from Pathanamthitta and Thrissur, 3 each. And from Kannur, 1 become negative. And also the hospitalized isolation or hospitalized surveillance is also, it is also reducing, number is also reducing. Yesterday we have 816 peoples in hospital surveillance. Today it become 715. And the per day admission, yesterday we have 176 new admission to the hospital, and today it become 86. And also in Kerala, the fatality rate also is very low, we can say.
How significant was it?
But it is not time to take rest,
had this entire health emergency be approached through the prism of humane approach. Ma'am, how important it was for all of you to have a very humane approach to this public health emergency, that it was not about social distancing but physical distancing per se.
Yes, it is if any victory we had goes to the preparedness and the people-centered plan, and also the unity of the people, the one health approach, the one government approach. That is why we can contain that Nipah at previously, that is the method of that, and also in the corona period also we took that approach. Under the leadership of our Chief Minister, each and every department joined together and everyone have their own duties. They are doing that, and we are evaluating everyone's duty, and all are helping health department to tackle this problem. And the most important thing is the surveillance, quarantine, and also isolation in the hospital and treatment. For the surveillance, everyone is helping us, even the police department and also the local self-government. To how many people are there in their panchayat, they are listening to them, and they are watching them whether they are obeying the quarantine principles or they are jumping. And we are giving very good awareness to the people. We are teaching them, stay home, don't come out. It is for the society. And the very good sign, the most of the people obeyed that. They were inside the home for the society, and that is why the community spread doesn't occur, and that is why human to human transfer reduces and the graph become flattened. And the people's cooperation and the unity of the unity in work and the preparedness, that helped Kerala very much.
Ma'am, last question to you. Of course, Kerala has the highest literacy rate, and it has also benefited from the fact that it has the best performing medical health infrastructure. How significant it is, for you all, because I was looking at the number of testing that you did. It was in fact 365 per million, which is much more than what most states are doing.
Yes, the Kerala's social sector development, that helped us very much. The literacy rate is very high, and also the individual attention. We are giving individual attention to citizens, that each and everyone have some lands and home and their own places to live. That kind of thing. helped us very much. Everyone have a little home, and some rich people have large home, and they can take rest in their home during the quarantine period. That's a very good step for this kind of development. And also, but we have some threats also. According to the development, our old age population is very high. That is a good sign, but in the case of corona, that become a real problem. That if these population have exposed to this novel coronavirus, that become very dangerous. And we have to the more than 15% out of total population are above 60, and that people they are our real concern, and we give attention to that with the help of social justice department, and with the help of Anganwadi workers and helpers, and ASHA workers also. We strictly followed them and watched them every time whether they have any symptoms or any difficulties, and we tried our best to remove them from the contact, or keep them away from the quarantined people or from the contact people, and that work also give us some positive results.
All right.
And another threat is in Kerala is the diabetic capital of the country, and this kind of comorbidity if occur, that also will become very difficult to the novel corona case, and we listen to that people also. We have very good house visits, and with our field workers visited them, and each and every time we are watching whether they have any want of medicine or any kind of difficulties. We are addressing that also. That way also we try to save their life, vulnerable people's life.
Thank you so much, ma'am. Thanks for sharing details of the Kerala